Now, hello, it's Dio Adenova once again. My hashtag Clear Vision Safety, hashtag Blind Safety Guy. What I started talking about earlier was an activity I was undertaking, which is to review risk assessment provided to me by a service manager. They wish to reinstate their services, and I decided, rather than spend so much time talking through review of their document, to simply just go through what I would be looking for. So I've written, to start with, on a notepad on my other computer. So at the start of it, I've written 5 elements of a COVID secure workplace. This particular activity I was looking at is an office-based one. So the first thing I wanted to do is say, okay, we've got 5 elements. The first one is that they should undertake a COVID secure risk assessment. Fine, they've given me a risk assessment to review. Second, do they have in place, hygiene practices, that being regular cleaning of the workplace, have a cleaning regime in place, hand washing with running water, warm water, and soap, facilities, provision of hand sanitizer stations to staff just in case they can't quickly or reasonably gain access to hand washing facilities. And in this case, I don't expect the staff to be on the move that much. So I haven't considered that they themselves, but obviously it's at their own discretion. We would need to necessarily carry boxes of sanitizer around. So I haven't labored on that too much. One thing that I felt was missing in that particular case, because this forms the elements of those 5 elements of a COVID secure workplace, is the supporting of staff to work from home. So this is one of the things I'm going to be raising with them. All the staff they've identified, why or how many of them will be working from home, and if they do have to come to the office, why do they need to be in the office? So that's something I've been really wanted to understand. And then, of course, the aspect of social distancing, that'd be my 5th element, which they have covered. Again, I will probably ask some questions around that. And then, of course, what do we do to avoid risk of transmission? At the moment, it's not that clear, aside from maybe when they're traveling to work and needing to use public transport, some maybe driving or walking. So from that viewpoint, what considerations are being made? When they are in the office, we don't think we need to worry too much about face covering, but I'm unsure about that. So we need to be clear whether or not face covering should be used in an office area. So that's something we need to get to the bottom of. So for me, having had a look on the Health and Safety Executive website, HSC, obviously this is, we're talking about England here. It may be different for a different country such as Nigeria, which I have interest in as well. The things, what I've written here is for the principles of coronavirus, COVID-19 risk control. So I've said in that I've taken it from the HSC website. So I said, identify which work activities or situations might cause transmission of the virus. They haven't actually done that. So I think I would like them to revisit their risk assessment. I, as a reviewer of the document, would like to be clear in the first instance, what is it you guys do? So that I'm a bit more familiar with what they do and be confident that they are covering all aspects of their work. Thinking about who could be at risk, they've identified, of course, however many employees. So from that viewpoint, I haven't got any issues. They've identified that they do not interact with other members of the public or contractor suppliers, so that's fine. and the likelihood. So they have got a likelihood and severity matrix with their view. So likelihood L, severity S, obviously. Then the risk rating they've just determined. In some places, after controls, I've seen that the risk rating is the same. So that for me would then mean, shall I be questioning the controls they've put in place? But we get to that. I've tried to adopt the 5 Ws and H principle as well. So here, what I've written is, when do they actually want to start the reinstating of their service? Oh, by the way, I'm a blind person for those that don't know, so I rely on my George screen reader to read my screen to me. So that's why there are pauses in places, because I'm listening back to what I've written down and wait for my system to read it back to me. So I've written why as well. So why is it necessary that they need to reinstate or return their service or work activities to that location? What at the moment are they doing under lockdown conditions that is working? Are they delivering their full service? Why is it essential? And are they actually telling me that they want to return the service in its full glory as it was prior to the lockdown, or only partly? So what are they asking for? Bring back half of their staff, bring back all of their staff, but on alternate days, and so on and so forth. So that hasn't been told to me, so I'd like to ask them about that as well. So, something else I've been looking for is where would they be working from? They should be specific about that. And whilst they're there, how long for? Is it a full 9 to 5 shift or only part of the day? So with that consideration, the sort of things I would then be wanting to open up, if they are doing a 9 to 5, the members of staff, where they're traveling from, does that mean they'll be traveling on public transport during peak period? So those are the sort of effects that could come about as a result. So we need to think about that as well. So I said what's there, and I've already mentioned it earlier in terms of how the lockdown affect their ability to deliver their full service. They don't interact with the members of the public based on what they've told me on their risk assessment. So if they don't, and the members of the public or contractor suppliers do not need to see them, why do you need to go back to that location? Do they need to use meeting rooms? No idea if that's going to be happening. Something I picked up as well whilst I was looking through. By the way, this is not so much specific to that team. Any other service can want to use this approach, but they appear still to be using telephones, like desktop telephones, which I thought we'd moved away from. I thought we had all moved to a Skype for Business based approach, which meaning that we don't have physical handsets or telephones on our desk. So I wanted to ask about that as well, because obviously that is I guess what we do is we've adopted a clear desk policy. So things such as telephone handsets realistically should have been done away with. So another consideration for me is members of staff who may have shielded previously, i.e. those who are in the vulnerable groups, i.e. someone that is clinically extremely vulnerable. It doesn't appear in this particular case that they've got one of those, or one of me. I was a shielded, still am a person until the 1st of August, when shielding is paused. Well, they've indicated to me that it's not the case for them anyway, so that's fine. There's no issue there. So they're not. And then there's the groups which are at risk. They haven't actually talked about that. I'd like to separate that. But I think they have covered, because we have actually got an individual staff self-assessment. So if they have covered their employees from the viewpoint of those two vulnerabilities, i.e. those that are particularly at risk because of their ethnicity, their gender, their age, and then, of course, in addition, those who are shielded individuals as a result of medical conditions. So I'd like to have been told that as well, and the factors that are considered. What they haven't told me is about first aiders, and fire marshals. That's important. That is important. So I'd like to, just a moment, please. Can you keep the noise down, please? That is recording. Be clear that if it turned out that there was an emergency, that the usual arrangements are still being adopted and put into practice. That is not clear from the risk assessment, and they have first aid if someone does get hurt for a reason, who is going to attend to them, following obviously expected normal practices. So I've already checked the managers of this particular service area are correctly registered on our accident incident system. So if anything needs to be logged, I know they will be able to report it. So from that viewpoint, we're okay. So in terms of consultation, employee consultation, Avani, can you keep that down, please? In terms of employee consultation, I'd like them to be able to confirm to me that that has been done. I could not tell in any of the paperwork, and any members of unions. That's something else I would want to make sure that the union representatives are being consulted or being, they've got some form of interaction with them. The transport aspect, that is a big deal. So I would like to have known that has been considered, but they haven't talked about that at all. And that is it. So thank you very much for listening, and I shall see you again.